So once again, welcome everyone. This is our November 2023 session of Community Health Learning Collective, or CHLC. We're so excited to have you all here today to share this virtual space and build community. We're also very grateful to our speaker, Maya, who I'm going to introduce to y'all shortly. If you are new to the group, or if it's been a minute, I just want to remind you that the Community Health Learning Collective is a group that I and Candace Straw facilitate together. We are the co-founders, co-facilitators, and we both work for the HAP Foundation in Chicago, Illinois. We are community health workers who work in the serious illness space, but this group is meant to be a very informal shared learning space for any community health worker, any promotora or promotor de salud, CHR, outreach worker, but also our allies, right? Folks who might not be CHWs, but who work alongside us or support our work. So the goals of these meetings, we have them once a month over Zoom. And the goal is really just to create a shared learning space, right? So we can learn not only from our wonderful speakers, but also from each other, right? To share experiences about the various different types of important work we're doing. Once again, I'm so glad that you're all here with us. It's great to see some faces, some pictures, some names. So I'm going to go ahead now and introduce our speaker. As I mentioned, each month we highlight a different topic or speaker that we feel like is relevant to the work of community health workers. So this month for November, we are thrilled to have Maya Gamble with us. Maya is an MPH, and she is the Chicagoland Community Impact Director for the American Heart Association. So we're very excited to have Maya, to hear from her and learn from her. So I'm going to go ahead and welcome Maya and throw it over to you.
Thank you, Maureen, and good afternoon, everyone. I am looking forward to chatting with you all today. I'm going to be covering a little bit about the American Heart Association and some of the work that my team and I do and kind of how we impact the community. And then we will leave it open at the end for some question and answers. You know, if you all have anything you want to ask, please feel free to do so. So I'm going to share my screen and get started. So give me 1 second here. Alrighty, can you all see my screen okay?
Yes.
Okay, wonderful. Thank you very much. All right, so the American Heart Association and who we are. So we are actually one of the oldest and largest nonprofit organizations that focus on, hypertension and chronic diseases, really anything related to heart and stroke health. So we are dedicated to ensuring equitable health in all communities through different collaborations with numerous organizations, whether they're clinical or community partners. And we are powered by millions of volunteers, donors, and sponsors. So we couldn't do this work without you all. We improve the lives of Americans in many ways. So we are the nation's leader in CPR education training. We help people understand the importance of healthy lifestyle choices. We provide science-based treatment. Skipping through my slides too fast there. Science-based treatment. So funding kind of like that research component, making sure that we're up to best practices, that kind of thing. We also educate lawmakers and policymakers. We advocate for change to protect and improve the health of our communities. And then we also work with diverse partners from all over to ensure that there is a cultural aspect in all of the health initiatives and things that we offer. Like I mentioned, we are the largest private nonprofit funding source for cardiovascular and cerebrovascular disease research next to the federal government. So we have invested more than $5 billion into research in these topics, and we have funded 13 Nobel Peace Prize winners and many life-saving research advances, such as artificial heart valve. I don't know what's going on with my screen here. I apologize. Artificial heart valves and just a lot of life-saving techniques. So since my screen wants to keep jumping, we're going to jump to the next thing. So at the American Heart Association, it's very easy to define our job, but we save and improve lives, and our mission really makes that clear. So we are a relentless force for a world of longer and healthier lives. But there's a lot more to what we do, and our work is really grounded in our guiding values. So ensuring that we are improving and extending people's lives, speaking with a trustworthy voice when we're working with community and clinical partners, inspiring passion and commitment, ensuring equitable health for everyone, bringing science to life and making extraordinary impact, as well as meeting people where they are. And like I mentioned, building powerful partnerships, because a lot of the work that we do would not be possible without you all. So the pillars of our work are under this umbrella of equitable health impact. So this past fiscal year, the Chicago market actually raised $1 billion towards health equitable impact. So all of these pillars that you see, these funds go to support those efforts. And a little bit later in the presentation, I'll kind of talk about how my team as community impact workers bring that to life. So obviously we couldn't have foreseen kind of the impact that COVID-19 had on the workforce, and kind of how it drastically changed some of our efforts and the work that we've done. Oh, I think somebody's off mute there. But despite some of the circumstances that we had, the American Heart Association definitely dedicated ourselves to kind of going with the flow and making sure that we were continuing to provide best practices, resources, and education for all those that were impacted not only by the illness, but these social determinants of health that we see on a regular basis every day. So some results of the work that we've seen from all of our research and the work that we do, we have seen a 71% reduction in cardiovascular deaths since 1968. We have also seen 53% reduction in coronary heart disease deaths since 1999, and 40% reduction in stroke deaths since 1999. So these are all just some statistics that show that the things we are doing are helping and working. Which brings me to the bulk of this presentation, which is kind of what me and my team do as community impact and kind of what that means for you all and the communities that we serve. So our focus as community impact directors with the American Heart Association is sustainable, equity-focused community change. So we essentially work with our clinical and community partners, and we help them implement sustainable health initiatives. We focus in an abundance of different areas, whether that's chronic disease, nutrition security, tobacco and vaping, community response, which is focused on CPR efforts, and then as well as women's health, and specifically more interest in maternal health as we go along. So our vision is that we are very committed to creating a healthier and more equitable community in Cook County and the Collier counties. So my team is made up of 5 individuals and we oversee Cook and our Collier counties. So this next slide is a picture of our territories. So we oversee a lot of area. There's a lot of need in these territories. So I actually oversee all of our efforts in South Cook County. We have another counterpart that oversees our efforts in West Cook County, and then I have another counterpart that oversees all of our efforts in the Collier counties. So Will, Kane, and DuPage, and McHenry. So I know I threw a lot of examples of some of the work that we've done out there, but I'm going to break that down a little bit and kind of share some examples of what that looks like. So one example that we have been working on a lot lately is our screen and refer opportunities, or blood pressure hubs. These are essentially standalone blood pressure devices or kiosks that we place in community organizations where we have worked with staff members, volunteers to kind of educate them, and patrons are able to come and measure their blood pressure on site. There's a lot of different components that come with that. There is a self-paced training that this staff member is up to date on, kind of knows how to work through. And then these individuals are also given a referral card, either like a postcard or a flyer, that refers them back to a clinical partner that we also work with if they are in need of additional care. So if they read with high hypertension numbers, we're able to refer them back to one of our partners that has gone through some of our best practice trainings, kind of within a 5-mile radius. So we have actually been able to set up quite a few of these screen and refer sites across the city. One example is Bethel New Life. We were able to work with them to place some blood pressure devices. And if anyone is interested in learning a little bit more about this specific project, I'm happy to share. But we've worked with a plethora of churches. We've also worked with some barbershops and salons, libraries, pretty much anywhere that individuals frequent in the community. We want to try to meet them where they are, educate those individuals, and connect them with the correct follow-up care. And then another example that has been very popular on our kind of work plate here is what we call cardiac emergency response plans. So in light of kind of what happened with Damar Hamlin and the cardiac emergency that he faced, AHA kind of took charge in wanting to ensure that every individual in every household was equipped and ready to act in a cardiac emergency. And one way that our team has been able to kind of catalyst this this effort forward is working with these community organizations to create these response plans, which essentially identify a team that is equipped to act in a cardiac emergency. So we help them develop a policy, which essentially lays out some of the things that individuals don't think of, such as when were the last time that the batteries in the AED were changed. Where is the AED placed? Who is the cardiac emergency response team? So we kind of walk through some of those specifics. And then the other component of this particular plan is walking them through hands-only CPR training. It's something that you can learn in less than 5 minutes. And so this is actually an example that we have rolled out with the YWCA. So this is one of our newer efforts. But we are implementing cardiac emergency response plans in all 15 sites across the city. And they will essentially be equipped with kits to be able to provide training opportunities for their volunteers and staff now that we have gone through this process with them. So those are kind of two examples of our work kind of in the real world and what we do. But we are always striving to make change, connect with new partners, see what opportunities and priorities are there. I know a lot of conversation that's come up and kind of how we got connected with the HAP Foundation is around training opportunities and specifically around, community health workers. And we do offer a lot of those education opportunities on our website, free of charge to anyone. So we have some toolkits and some lesson plans that focus on a lot of the pillars and things that I didn't cover today, but additional resources that we're able to provide. We do a lot. Our hands are in a lot of different plates, but we like to be kind of the middleman, be able to provide you all with education, proper resources and connections to be able to get that training and education that you are looking for. So I know I have thrown a lot of information out there and it was quick and fast, but I'm going to stop here and see if there are any questions for me about kind of the work that we do or anything that I can answer for you all.
Thank you so much, Maya. We can definitely open it up for questions. That was a lot of great information. One question that I had, I know that you are working in Cook County, Collier County, Chicagoland area, and you had that wonderful map that kind of showed the different service areas. I know we have a lot of folks on the call who are local to Chicago, but this group also serves CHWs in many different states. So I'm just curious, at the American Heart Association, does like every state and community have someone like you, or is it like based on the population levels or the need or the risk?
Yes, that is a great question. So we are a nationwide organization. We do oversee, there is one of me everywhere in the United States, at least. Chicago is lucky enough to have a larger community impact team. So there are 3 directors that sit on our team. But we do have an individual in every region within the 7 regions that we cover. So if there are some individuals that are, online that live in some different spaces, we are absolutely able to connect them with a community impact director in their area. Although we cover a robust amount of territory, we do look at community needs assessments, kind of work with our clinical partners to determine kind of those specific areas that we should be working on. And then, like I mentioned, we lead with priority of the partner. So although our hands are in a lot of different pots and a lot of the work we're doing at the moment is around hypertension and CPR, we have resources and education materials around a lot of different things. And so if your focus is something different than that, we're also able to help support in that way as well.
And I actually, I want to
I
encourage
see a
everyone.
question.
Oh,
Sorry,
sorry.
Mary.
Go ahead, Candace.
Yeah.
I see a question. Go ahead, Mary.
Yes, thank you. Maya, this has been very helpful. Thank you so much. So one of the things that we've all got access to is for Chicago is this index called Chicago Health Atlas, which helps us to understand what we're dealing with in different communities in regards to health risks and health outcomes. So I just know that the community that I'm working in, tragically, is second highest for CAD deaths. And so I was curious about the blood pressure kiosk program. How long would something like that be available? So that's question number 1. And then question number 2, I know that we're all focusing in on maternal health and health issues surrounding being pregnant, and there are some communities that are having more concerns about that. What is the focus that you will be trying to address when you do reduce risk in women? What is that all about? Thank you.
Yeah, those are great questions. Thank you, Mary. So for the first question, our hypertension efforts, specifically around the blood pressure kiosks, the kiosks themselves are typically funded opportunities. So it depends on what we have available at the time. Those are 2-year commitments for those, but we do also or are also able to offer standalone devices, which do the same thing. They're just not as pretty. And that's kind of on a rolling basis. So all the educational materials and supporting resources to those blood pressure devices are completely free of charge. And when we work with our partners, we look to find funding opportunities to support your efforts. So it's on a rolling basis. So if you are interested and would like to place something in, where you're working or what you're doing, I'd love to connect and kind of see what opportunities there are. But there is no, kind of hard, fast deadline for that. And then to your second point around maternal health, that is actually a space that we are looking to actually grow in. So we are in a learning space as well. Our focus would definitely be around blood pressure and kind of what that looks kind of postpartum, what blood pressure looks like as mom is pregnant, that kind of thing. But we are also in a learning space to kind of see where our efforts are best used. But our area of expertise would definitely be around blood pressure in the maternal health space at the moment. So yeah.
Thank you.
Yes, thank you.
Those were great questions. And if anyone else has questions, please put them in the chat. You can also do the raise your hand or unmute. Just going back to the blood pressure kiosks, because when I saw that, I was like, oh, yes, this is wonderful. I don't consider myself that old, but back in the day, you used to be able to go into nearly any like Walgreens or pharmacy, and they had the machine that you could use for free. And one of the reasons why I think this is important is not only convenience, but like I have high blood pressure, it runs in my family, my mom has it, and it's very common for the doctor to tell you, well, yes, you can buy a blood pressure machine like for home use, but
Mhm.
it's not as accurate. So they actually recommend that people go to like a kiosk, and there's fewer and fewer kiosks out there. So I think that's really cool that y'all operate those. And I'm curious, you might have said and I missed it, but how many of those are you operating right now, like in the area?
That's a good question. So I think, let me think. We have 5 screen and refer stations like kind of up and running at the moment with blood pressure kiosks, and then the standalone devices, I'd have to go back and check and see. I can definitely get back to you on the number, but we're in a lot of different areas. And I know I didn't go into detail, but we do also work with our clinical partners around those same efforts. And so with those screen and refers in the clinical space, we help them implement self-monitoring blood pressure programs. So those are usually like one-to-one blood pressure devices. And we work with those clinical partners to kind of figure out what their program is going to look like. Some clinical partners do kind of like a rental process where individuals can come rent a blood pressure device, come up with a treatment plan with their provider for an extended amount of time, and then they come and bring the blood pressure device back. We've also worked with clinical partners that have been blessed to be able to offer those patients with a device that they can keep. And then they also go through the same process of going through a treatment plan, going for an extended amount of time and kind of seeing how things play off of that. So those are 2 different ways that we are able to assist. When we have funding to do so, we are able to provide blood pressure cuffs for those opportunities as well. So we have paired those with, we called them hypertension toolkits that came with additional educational materials. It came with a tracking log. It came with some additional heart health material. So that's just kind of another way that we've been able to impact the community in that space as well.
I have a question.
Yes.
So do you do what type of I heard you say community impact, coordinator. So how many do you currently have? Now, you don't have to tell me every county in Illinois, but how many do you have currently? And also, I know that you all partner with churches because I've gone to churches and I've seen the blood pressure kiosks in the churches, and I thought that was so, much needed. And also, do you do a lot of community outreach, like tabling events? Do you do, and if you depending on how many impact coordinators you have, are they spread out? Do they do other type of presentations like you're doing for us?
Yes, no, that's great. My counterparts are actually on the call today, which is great. So there is 3 of us in total, and we cover all of Cook and the Collier counties. So I oversee all of South Cook County. My other counterpart oversees West Cook County, and then my other counterpart covers that lovely rural county-ish area, so Lake Kane, DuPage, the Collier counties
Okay.
that are way far out there. So that is definitely a robust amount of territory. So we try to dig in, and we have a little bit of a different focus area from year to year, depending on, what we see in those community needs assessments, depending on what partners we've been able to connect with based on priorities and things that they've had. And then you mentioned churches and working with the churches. We have actually been kind of focusing in this year on our faith-based strategy and kind of connecting more with faith-based communities and kind of figuring out ways to assist them and support them when we think about hypertension efforts and that kind of thing. So we've been having a lot of conversations with them, a lot of learning conversations, open dialogue to learn what they're seeing in their congregations and kind of what their priorities are. And we have been able to place a couple of those blood pressure kiosks, which we've seen some great return, individuals coming in and continuously checking their blood pressure, being referred to clinics that we've worked with on the back end. And my counterparts do the same thing. They are able to, kind of present. We don't currently have the capacity to table like we would love. too, with a team so small. But we are making it a priority for us to be more engaged in the community. So kind of doing some of these presentations like I'm doing today. I know we will be at your Community Health Worker Summit earlier next year. So we are definitely making it a priority to kind of connect with folks and kind of get our face out there and talk to people about what we're doing. So thank you for that.
Great. Thanks, Maya. I see. If is it Makita, you can come
Yes,
up.
it is. Thank you.
You can come up and ask your
Oh,
question.
you said it right. Thank you. That's well, it's very nice to be here. I am Makita Warner. I'm a health and safety manager for Gas Hill Center. So we are a social service organization that has daycare centers, and we actually take care of the whole child and support families. So I think this would be a good resource for our families and kind of educating them, because we see a lot of things that are impacted by our community. So you were talking about the blood pressure machines. My question is, have you ever placed one like in a daycare center? Do you work with social service organizations? I heard churches and other things, but
Yeah, that is also a great question. We have not placed device in a daycare center, but we did have some work going on with WIC, where we were going to be placing blood pressure devices in a few of their locations. That was our first time kind of working with, I guess, a social service entity. So there is no organization that is like hands off, if you will. If we find a way to work with you, we will. So if there is a need and an opportunity, we can definitely see about making that happen. So yeah.
awesome. And then I also wanted to connect, I guess, to those that would be presenting to, because we have health clinics, and I think it's important to just keep people abreast of the resources that they have available, because sometimes they don't know what they have available, so they think they have to just deal with things or
Mhm.
settle, or so I just would like to be able to connect and partner in that way too. So thank you.
Absolutely. I just dropped my email in the chat, and I will also ask my counterparts that are on the call for them to drop their emails in the chat as well. If you reach out to any of us, we are happy to connect you with either the correct director for that territory and continue conversations to see what opportunities exist. So yes, thank you for that, Makita.
Those were great questions. There's also a good one in the chat from Alexiana. She says, you mentioned that efforts extend to churches, barbershops, etc. Could you share more about how your initiatives are tailored to address the unique cultural, social, and economical characteristics of the communities that you serve?
These are all great questions. I really appreciate. I would say we are continuing to always look at these components when we're, going out into the communities and addressing these issues. A lot of our resources are in both English and Spanish, which is something that we keep in mind with the hopes to be able to expand. I know we have some resources also in like Portuguese and in Russia and in Russian. So we kind of talk to each community organization or clinical organization and kind of see again what their priorities and needs are and try to tailor our efforts in that way. We have looked at kind of these high need areas and seeing what they need. So barbershops in particular, when we have worked with them, we went in and had a conversation and asked them, like obviously we don't want to place a kiosk in a barbershop that is, like very small and on the corner. So we asked them, what do you need to help make this successful? And that's kind of how a lot of our conversations start with these partners. And we are able to kind of tailor and change our resources, education materials to kind of fit those specific cultural needs, economical needs, that kind of thing. When we worked with the blood pressure, they didn't have like a TV or anywhere to display for individuals to go through the training. So we were able to provide them with a computer so that they were able to have this in their barbershop and then have their patrons come through and kind of go through the training, measure their blood pressure, and be referred the same way. So it is forever changing, but we do take that into mind, every time we're having these conversations with our partners. So thank you for that question.
So I have another question,
Yes.
Maya, and I don't want to monopolize the questions, but while maybe other folks are formulating theirs, I think you mentioned that on the website, you have some like free educational resources, and I
Yeah.
know obviously it's something that we're talking about and thinking about as far as like specific education for community health workers, like formal training. But just in the short time that we have here, or like
Yeah.
thinking about other sessions similar to this one where folks might only have like an hour of time. I'm curious, like, if you can provide any other guidance on like what do you think we as CHWs should know? Because I'll tell you that like for me, when I think about like heart disease and heart health, it's like I know heart disease is like super common. It's like a leading cause of death. And I know that you need to keep your blood pressure under control. But then like after that, I'm kind of like, I don't know that much more about it. So like I'm wondering if you do like guidance on like heart healthy diet or like exercise or like any other recommended screenings or warning signs.
Yeah, that is a great question. So as we know, like obviously heart health is affected by a ton of different things. So it's not necessarily just, based on your circumstances. It could be passed down generation, it runs in your family. So you're at higher risk in that way. Depending on your diet, you're at higher risk in that way. Physical activity, that kind of thing. So we actually have, I'll drop in the chat, it's called Life's Essential 8, which kind of focuses on what we've identified as kind of like the 8 components that you should be, I guess, focused on when we're thinking about reducing hypertension. So I don't know if that is the best answer to your question because there are a lot of moving parts. There's not necessarily just one thing. But I would say this is a good place to start, and focusing on each one of those pillars, there is an abundance of resources and education. So our Life Essentials 8 website breaks it down into 8 key measures that improve and maintain cardiovascular health. So these are anywhere from being more active, quitting smoking, getting more sleep, managing weight, controlling cholesterol, like that kind of thing. And there is a lot of infographics and supporting materials that go off that, but I think that's a great place to start when you think about like what could I be doing or what could next steps be. Another thing I would say is just kind of making yourself well versed on the educational materials and resources that are out there. I know, although we are one of the leading organizations for this, there is a lot of information that's out there, and we have a ton of resources on our website that are free to everyone to use, and a great place to start when you're thinking about, going out into the community and educating others.
Thank you so much.
Yeah.
There's also a question in the chat from Iris, thanking you for the presentation and then asking for more information about Healthy Heart Ambassador Program, which sounds
Oh, that is, yes, I will. If you could please send me an email, I will be sure to follow up. I do know that that is a program. I don't have all of the information on that, but I can find out for you and send it to you and follow up.
Yeah, and I just want to say or remind, I'm not sure if I said it before, but Maya will share her slides with me and other like links that she has, and I'll send it out to the group. And I think Maya, depending on how long it takes you to get an answer, I think if you can find out about that ambassador program, I might share that as well, because I think like
Absolutely.
ambassador kind of goes with the work of CHWs, and I bet there's a lot of people that might be interested in becoming one, or at least learning more about that.
Yes. Thank you for that. You all have had great questions today. Anything else
So
for me?
I wanna, oh, sorry.
No, I was just asking if there was anything else for me. Any other questions?
This
Yeah,
has
I
been
just
super
want to
helpful, actually.
thank you so much for your presentation. It was great, and for taking time to answer questions. I also want to just leave some more space in case any other questions or comments come up. But I also want to use a little of this time while maybe folks are still thinking of questions to start with a few announcements. So I'll make a few announcements, and then I'll also open it up if we have members that want to share an announcement or introduce themselves or talk a little bit about their work. So our main announcement, as was mentioned, is the Hat Foundation is hosting its inaugural first ever Community Health Worker Summit right here in Chicago on January 24th, 2024. So I'm going to be putting a link in the chat momentarily. This is the link to register. So tickets are $20. It's a full day event. We're going to have a lot of amazing speakers, panelists, and a lot of great networking. So I put that in the chat. I hope that folks will register because we'd love to see you there. I'm also going to put one more link in the chat. So we're very lucky that the Illinois Primary Care Association is offering scholarships. So if you are a community health worker in specific counties of Illinois, they are offering scholarships for you to travel from that county to Chicago to attend our summit. So I put the link in that. It's like a Google form. And it's again for specific like downstate Illinois counties. So we're very, very grateful to them for offering that scholarship, because we want to bring in as many folks, as many CHWs to this summit as we can. I also know that we have people who are not in Illinois, so I just want to say that you know, this is our first time doing a summit, a big in-person event. We're so excited, but we're also like learning a lot during the process. So, you know, we hope that maybe if we do it again in other years, we might have a virtual component, or we might have other ways for people who are further away physically to be with us. But we thought it's like a really nice companion to this group, right? We have CHLC, and this has allowed us to connect in the virtual space. And now it's like we're really excited to connect in like a real life physical space. So check out those links, and I'll also share them in the follow-up email. I also want to let you know this group typically meets once a month, but we usually skip December just because of the holidays and there's a lot going on. So that is our plan, to skip December. And we hope that if you're celebrating any holidays in December, that they are lovely. We'll miss you, but we'll be excited to come back together in January for CHLC and also for the summit. So let me pause there. If anyone has any more questions, comments, praise for Maya, please feel free to unmute and share. And similarly, if you would like to introduce yourself or make an announcement or ask us a question, feel free to unmute and do so.
We take questions. If there's anything cool your organization is doing, please send it in the chat. Is everybody still eating turkey, or? Okay, that's a joke.
Well, they still have the itis from Thanksgiving.
That's what
I will throw a shameless plug out there. I know I shared the examples of some of the work that we're doing, but we do currently have some funding supporting our CPR efforts. So if anyone is interested in learning a little bit more about the opportunities we have there, we are always looking to connect. So shooting us an email is fantastic. Even if you reach out to the wrong director, we will get you connected with the right one. So please, please, please just reach out so we can have an exploratory conversation and kind of figure out how we can support you all.
Great. That's some really good information.
Thank you.
Adam says the CHW review board meets tomorrow, 11:30. Where, Adam? Is there a link, or is there anywhere?
No, those meetings are virtual. I don't know if Adam has the link and he can share it. That would be great. Otherwise, I can try and find it and put it in the
There it
follow-up
is.
email. Another quick announcement that I'll make is that we are seeking speakers for 2024 CHLC sessions. So if you have a topic that you would like to present on, much like Maya did, whether that's like a short overview of the work of your organization, or whether it's like a full-blown like training workshop, we would love to hear from you. I will be putting my email in the chat, and you can reach out to myself or to Candace, because we are scheduling folks to be our, featured speakers for all the different months of 2024.
So we don't have any more questions.
That's all right.
One quick question, and then I think if no one else has any, we'll conclude. But I was just curious, does the American Heart Association employ any community health workers directly?
We do not at the moment. We are, this is another space that we are learning more in. So we actually have a pilot program, and once those resources become available, I'm happy to share with you all, but we're piloting our own community health worker training at the moment, specifically around hypertension. It just started, it just concluded. If I had got it just a little bit sooner, I would have totally sent it over to you all. But once those resources are available, I will send them over. We are looking for ways to engage with you all more. But I will say right now, these are the best opportunities, kind of figuring out what, where we can offer some additional training, some additional education resources, that kind of thing. And we also do a very good job at playing connector and connecting you all with, different organizations that might be looking or in need of community health workers. So we also are able to assist in that way too.
Great.
Awesome.
Deborah, you can come off of chat and ask your question.
Okay. Thank you. I was trying to find my notes. I was stumbling over my notes, but when you mentioned the cardiac emergency response plan, so would you recommend that anyone that's seeing large groups of people, like a church, library, anything like that, they should have a cardiac emergency response plan? Is this mandatory for large organizations? Is it part of their insurance requires it? How would one go about making sure they did have a cardiac? In church, we're gonna first pray for you, but
No, definitely. That is a fantastic question.
yeah. So
It is,
I'm sitting here running in my mind, who is it and where will we go? Because the first thing they're gonna do is say, get the elder and let's pray. But the
no,
reality
absolutely.
of our culture, okay. But
yeah, no, it is not a requirement. This is not something that is needed, but or I won't say that's needed. This is not something that is required, but it is something that we highly recommend.
okay.
So for example, one of the churches that I work with, that actually, unfortunately, they had a cardiac emergency, which kind of pushed the cardiac emergency response plan, I guess, priority a little forward. They had an AED and it didn't work, and nobody was equipped, to act in the cardiac emergency. So we do ask for individuals. We actually have a template that we provide to help you fill out that kind of lay out all of those different types of things that you should be thinking about. And then we ask our partners to share them with first responders. So your fire department, your police department, just so that they're aware that you have it. I am actually going to drop in the chat our CPR website that kind of talks a little bit about our cardiac emergency response plan. But that is something that we help you develop. We will help you walk through it, create it, kind of think of the components that should be put in there, and help you get it kind of up and running.
Thank you so much.
Absolutely.
Thank you.
And training or education does come with that as well. And these efforts are also, thank you, Jocelyn, are my counterpart Jocelyn also speaks Spanish, but a lot of our resources also are in Spanish. So if there is a need for that, we also have that as well.
That's great. That was a great question. And how, you know, how tragic to have a machine that
Yeah,
doesn't work.
you don't
So
know
I
you
think
need
that
it
goes
until
to
you need it.
show. Yeah, yeah. And I think it goes to show that like we need to be a little bit more long-sighted, right? We can't just be handing out machines. People have to know like how to maintain them,
Mhm,
how to check them,
mhm,
when to replace them, because I think sometimes people are like looking for a quick fix, like we'll have this
mhm.
machine and then problem solved, and then you know it's worthless if it can't save a life in that moment.
Absolutely. Thank you for your question, Deborah.
You're welcome.
Okay, I'm gonna do one more last call. Any more questions, comments for Maya, or any just questions, announcements, events you want to share with the group? All right. Candace, did you have anything you wanted to share? You good? You're on mute.
Whole conversation with myself. Thank you, Maya, for attending, and thank you so much for presenting. We look forward to hosting you and your colleagues in January at our summit.
Yes.
Thank you, Adam, as well, for sending along this information. Maureen will send a follow-up email with all of the information that has been shared. And if that's it, we can give you back some of your day.
Yeah,
Love it.
thank you, everyone. Thank you so much, Maya. Thank
Yes,
you to
thank you for
your
having me.
American Heart
Thank you
Association
all. Thank you
colleagues
for-
for joining, and thanks
Thank
to all
you.
of our members for being here. We hope to see you at the summit in January, and we hope to see you at our virtual sessions this upcoming year. So take care, everyone. Have a great day.